Imagine you are an ancient human, and today your body has decided to start acting weird. Not a little weird. Not, I slept funny weird. More like your skin is hot, your stomach is making ocean noises, one tooth feels like it has a tiny, angry person living inside it, and everyone in camp is looking at you like, bad. There is no doctor. There is no pharmacy. There's no urgent care. There's no little bottle that says take two and stop being dramatic. There's just you, your fever, a bunch of people wearing animal skins, and one guy who's way too confident about a leaf. So what did ancient humans do when they got sick? The short answer is, whatever they could think of. The longer answer is, some of it was actually smart, some of it was horrifying, and some of it was the kind of idea you only get when nobody has invented school yet. They used plants, they used honey, they used sharp stones, they used smoke, they used prayers, they used animal fat, they used holes in skulls, which is not usually where you want a hole. And sometimes, somehow, it worked. Ancient medicine was not one clean thing. It was not a wise old healer calmly opening a neat little medicine cabinet. It was more like thousands of years of people going, last time Grug ate that root, he stopped coughing. Also, he saw ghosts for 2 days, so maybe half a root. That is basically research, but with more screaming. The first thing ancient humans probably did was the most obvious thing. They watched. If someone got sick, the group noticed everything, because noticing things was free, and ancient people loved free stuff because the other option was dying. They noticed which wounds got worse. They noticed which plants made stomach pain better. They noticed which plants made Uncle Rockface lie down and speak to a tree. Nobody knew about bacteria. Nobody knew about viruses. If you explained germs to them, they would probably think you were describing tiny invisible demons, which honestly is not the worst description. But they did know patterns. This plant helps pain. This bark helps fever. This berry is a terrible idea. This wound smells like the person is entering the bad zone. That kind of knowledge mattered? A lot. A sick person was a problem for the whole group. Not because people were cruel, but because ancient life was already a group project held together with rope, fire, and everyone pretending they were not tired. If you could not walk, someone had to help you. If you could not hunt, someone had to feed you. If you had a fever and started mumbling at a rock, someone had to decide whether the rock was important. This is where medicine starts getting interesting, because ancient humans were not just throwing sick people into the bushes every time they became inconvenient. Sometimes they carried them. Sometimes for years. In Borneo, archaeologists found a skeleton from about 31,000 years ago. The person was missing the lower part of one leg. And it was not some messy accident where an animal chewed it off and everyone shrugged. The bone looked like it had been cut, carefully enough that the person survived. Not survived for 5 minutes. Not survived long enough to say, well, that was a mistake. They lived for years. That means somebody did the ancient version of surgery. With stone tools, in a rainforest. With no hospital, no antibiotics, no clean white room, and probably no one saying, this procedure has a 98% success rate. Someone had to cut the leg. Someone had to stop the bleeding. Someone had to keep the wound from turning into a nightmare. And after that, someone had to help this person live. That last part is the big part. The surgery is impressive. The aftercare is insane. Because a person missing part of a leg in the ancient world is not exactly convenient. They slow the group down. They need food. They need help moving. They are not going to sprint away from a large angry animal unless hopping counts, which it does not. But the group kept them alive anyway. That tells us something kind of uncomfortable. Ancient people may have had worse tools than us, but they were not stupid little cave NPCs walking around bonking rocks together. They noticed things. They learned things. They cared about people who could not pay them back right away. Neanderthals did this too. At Shanidar Cave, one Neanderthal man lived with a lot going wrong. He had serious injuries, a damaged arm, hearing problems, a limp, a face injury. Basically, his body had a whole complaint department. And he lived a long time. That does not happen if everyone around him is like, good luck, buddy. We are going over there now. It means he had help. Food shared with him. People who let him stay with the group. People who probably had to repeat themselves because he could not hear well, which is annoying now and was probably also annoying when everyone smelled like smoke. So before ancient medicine was fancy, it was social. It was someone bringing water, someone keeping you warm, someone cleaning a wound even though it looked nasty, someone sitting near you while you sweated and made weird noises. That is not a magic cure. But without it, most cures do not get enough time to do anything. Of course, ancient humans also tried actual treatments. And this is where things get very, please do not do this at home, take wounds. If you cut yourself badly, ancient people had to improvise. They might wash it. They might pack it with plant material. They might use fat. They might use ash. They might wrap it up. Sometimes they made it worse. Very worse. Putting random dirt into an open wound is not ideal. That is the scientific term, not ideal. But some of their choices were surprisingly decent. Honey, for example. Ancient Egyptian doctors used honey on wounds. They mixed it with things like fat and linen, then covered the injury. That sounds like something a person invents after looking at breakfast and a bleeding leg at the same time. But honey can actually make life harder for some microbes. The Egyptians did not know that. They did not have a tiny germ chart. They just saw that some wounds treated this way did better. So they kept doing it. That is ancient medicine at its best. A good result, remembered by people who did not fully understand why it was good. Then there were plants. Plants were everywhere, which made them useful and also deeply suspicious. A plant can feed you. A plant can heal you. A plant can make you vomit for 8 hours and reconsider your entire personality. Ancient humans had to figure out which was which by experience, tradition, and probably some very unlucky volunteers. There's evidence that Neanderthals used or at least consumed bitter plants like yarrow and chamomile. These are not exactly fun snack plants. Nobody's sitting there going, bitter leaf, nature candy. But bitter plants can have effects on the body. Some help with inflammation, some help the stomach. Some do absolutely nothing except taste like punishment. The important part is that ancient humans and their relatives were paying attention. They were not just eating whatever was closest to their face. Mostly. For pain, they had plant options too. Willow bark, later known in many cultures, contains compounds related to aspirin. Other plants could numb, calm, purge, or knock a person sideways for a while. The problem is dosage. Modern medicine cares a lot about dosage. Ancient medicine was sometimes more like, try a handful. That is not a dosage, that is a dare. So treatments could help, or they could make the sick person even more exciting to watch. Stomach problems were probably common because ancient food safety was basically smell it and hope. Bad meat, dirty water, parasites, random berries, a mystery mushroom. Everyone had many opportunities to make poor digestive choices. If someone got stomach sickness, people might use bitter herbs, charcoal, clay, fasting, broth, or just the ancient classic. Wait and see if they stop being sick or stop being alive. Not a great system, but it was the system. Teeth were another disaster. Ancient teeth had a hard job. They were chewing tough plants, gritty grains, dried meat, and probably the occasional pebble pretending to be food. If you got a cavity, there was no dentist appointment. There was only pain, swelling, and eventually someone deciding to get involved with a pointy tool. Archaeologists have found ancient teeth that were scraped, drilled, and even filled. One old tooth from Slovenia had beeswax packed into a crack, which is kind of brilliant and kind of gross. Imagine your tooth hurts, and the local tooth guy says, "Open your mouth. I brought wax." You ask, "Are you a dentist?" He says, "No, but I have confidence." And that was your dental plan. Still, sealing a cracked tooth is not a dumb idea. It might reduce pain. It might protect the tooth. It might also make you deeply unpopular for a few minutes while everyone hears the procedure happening. Then there is the ancient medical idea that everyone remembers because it is so simple and so terrible. Trepanation. That means making a hole in the skull. A hole. In the skull. The container where the thinking pudding lives. People did this in many parts of the world. They scraped, drilled, or cut openings into skulls. Sometimes maybe because of head injuries. Sometimes maybe for headaches or seizures. Sometimes maybe because someone had a bad idea and a sharp rock. But here is the annoying part. Some people survived. You can tell because the bone around the hole healed. It smoothed over. That means the patient lived after the operation. Ancient Peru has a lot of evidence for trepanation, and over time, some surgeons seem to have gotten pretty good at it, which is a sentence that feels illegal, but here we are. No modern anesthesia, no sterile tools like we have now. Just experience, plant drugs, alcohol, sharp instruments, and a patient having the worst afternoon in the village. It was not always a disaster. That does not mean it was fun. It means humans are weirdly tough and also weirdly willing to try things. And then there was magic. This is the part modern people like to laugh at, but we should be a little careful. Yes, ancient people used charms, chants, spirits, rituals, and prayers. Some treatments were basically, the sickness is angry, so we will say words at it. Not very strong against infection. But rituals also organize care. If everyone believes the sick person needs to be watched, fed, cleaned, warmed, and treated at certain times, that is useful, even if the explanation is wrong. The chant may not kill germs, but the person doing the chant might also be changing the bandage. The prayer may not fix a fever, but it keeps people gathered around the feverish child instead of ignoring them. That is the weird thing about old medicine. The bad ideas and good ideas were often glued together. A healer might wash a wound, add honey, wrap it carefully, and also say a spell. The spell is not doing the medical work, but the washing and the honey might be. So from the outside, it looks silly. From the inside, it is a messy bundle of comfort, tradition, treatment, and someone trying very hard not to panic. Honestly, that still describes a lot of waiting rooms. The biggest difference between ancient medicine and modern medicine is not that ancient people never had good ideas. They did. The difference is that they did not have a good way to separate the good ideas from the garbage ones. Honey on wounds, sometimes useful. Random dirt on wounds, bad. Certain plants for pain, useful. Mystery plant because it looks important, risky. Rest in fluids, good. Drilling skull holes because the vibes are off. Let us maybe slow down. They were guessing, but not always blindly. They were guessing with memory. And memory was everything. One person remembered a plant. Another remembered a wound. Another remembered that the red berries killed two cousins and made a third cousin talk to the moon, so maybe skip those. Over time, this became tradition. The healer was not always the person with magical powers. Sometimes the healer was just the person who remembered the most bad outcomes, which is a very ancient kind of job training. So what did ancient humans do when they got sick? They did what humans always do when the situation is bad and the instructions are missing. They guessed, they argued, they copied what worked last time, they blamed invisible forces, they put stuff on the wound, they ate the weird leaf, they made the skull hole, they regretted some choices, and sometimes they saved each other anyway. That is the part that sticks. Not every treatment worked. A lot of ancient medicine was probably awful. Some of it was dangerous. Some of it was just a confident person being wrong near a sick person. But the bones show people surviving things they should not have survived alone. A healed amputation, a Neanderthal living for years with injuries, a skull with a hole that closed around the edges, a tooth sealed with wax. These are not just medical facts. They are little messages from people who had no labs, no x-rays, no antibiotics, and no idea what was happening inside the body. The message is basically, we tried. Sometimes badly, sometimes weirdly, sometimes with way too much confidence. But they tried. And before medicine became science, it was mostly that. A sick person on the ground, a group standing around them, someone holding water, someone holding a leaf, someone holding a rock that maybe should not be used for surgery, but unfortunately, this is the available technology. And somewhere in that mess is the beginning of medicine. Not clean, not polished, not always smart, but very human. Ancient medicine started with one simple idea. This person is sick, and we are not leaving yet.